Good day, ladies and gentlemen, and welcome to today's National Alliance for Caregiving, Extra Help for Prescription Drug Costs under Medicare's Low Income Subsidy webcast. If you would like to ask a question during the webcast, you may do so by clicking on the Ask Question button on your screen. Simply type your question in the box and hit Send. At this time, it is my pleasure to turn the floor over to your host for today, Ms. Karen Marshall. Ma'am, the floor is yours.
Thank you. Good afternoon, everyone, and welcome to the National Alliance for Caregiving's webinar on extra help with prescription drug costs through Medicare's Low Income Subsidy. Again, my name is Karen Marshall, and I'm NAC's Director of Advocacy and Engagement. Managing the cost of care, including prescription drug costs, is a major concern among family caregivers. The purpose of today's webinar is to equip you, state and local family caregiving coalitions and advocates and other stakeholders in our network with tools to help educate family caregivers in your communities about Medicare's Low Income Subsidy, which is also known as LIS or Extra Help. We are so glad that you can join us, and we thank you for taking time out of your busy schedules to participate in this programming. We're proud to develop and present this webinar with grant support from our member, Eli Lilly and Company. Today's webinar will have two parts. For part one, we're delighted to partner with one of our frequent collaborators and another NAC member, Centers for Medicare and Medicaid Services, also known as CMS. In a few moments, I will turn the presentation over to David Santana of CMS for a subject matter presentation on Medicare Part D's Low Income Subsidy. David's presentation will provide valuable background on Medicare for those of you who are relatively new to the program, while also providing more in-depth information on the Low Income Subsidy for those of you who are familiar with Part D already. As stated earlier, you're welcome to submit questions for our guest speaker during this presentation. At the end of David's presentation, I'll act as moderator and convey those questions to him as time permits. The second part of today's webinar will focus on the launch of the National Alliance for Caregiving's Toolkit, which can be used in your local caregiver support and education efforts. We'll introduce you to the LIS Toolkit and offer ideas on how to use it following our guest presentation. Now it is my pleasure to formally introduce our guest speaker, David Santana. David is a health insurance specialist at the Centers for Medicare and Medicaid Services and also serves as a subject matter expert and lead trainer for the National Training Program Division in the Office of Communications at CMS. In this role, he is responsible for effectively developing educational materials and communicating information about CMS programs and resources to CMS stakeholders. In addition, David provides technical assistance concerning CMS program policies to governmental entities at the federal and state level, as well as local agencies and organizations. David, thank you so much for joining us today. Now, without further ado, I hand the presentation over to you to enlighten us on extra help for prescription drug costs under Medicare Part D.
Thank you, Karen, and hello, everyone. Thank you so much for taking the time to spend a few minutes with us to talk about some very important topics with regards to Medicare. So you probably are aware of the kind of the general purpose of the Medicare program, but Medicare is one of our nation's most important and successful programs. Since the beginning of the Medicare program, it has helped lift generations of Americans out of poverty. Now, before the enactment of the Medicare program in 1965, only 50% of seniors had health insurance, and 35% of them live in poverty. Today, we have over 62 million people that are receiving guaranteed health care benefits through the Medicare program, regardless of their medical condition or income. Together with the Social Security and Medicaid, Medicare provides health and retirement financial security for today's seniors and individuals who are disabled. Now, my goal today is to provide you with basic information about how to use the Medicare program or understanding the Medicare program and help you make and inform healthcare choices with regards to Medicare and low-income subsidy. Now, making the right choice meaning getting the best possible healthcare coverage for you and your family. Now, we're going to start the presentation by talking a little bit about, and again, giving you some basic information first about the Medicare program and then going in more detailed information about low-income subsidy. Now, Medicare, before we go into the parts of Medicare, for the basic understanding of who qualify for it, Medicare is a federal health insurance program for three groups of individuals. Those who are 65 years of age and over, individuals under 65 and receiving Social Security disability benefits for about 24 months, and individuals at any age who developed end-stage renal disease that require kidney dialysis or kidney transplant to maintain life. Now, for the vast majority of individuals, understanding the Medicare program is a little bit complicated when it comes to the parts, because Medicare have different parts. And the best way that we can go about explaining the parts of Medicare is to think about any knowledge that you have about private health insurance. The only difference with Medicare is that different parts of Medicare pays for different healthcare settings. For example, when you go to the hospital, that goes under Medicare Part A hospital insurance. That hospital insurance, for the majority of individuals, almost 99% of people in Medicare, it comes with no premium. So it's premium-free for hospital insurance. That's Medicare Part A. Under that part, you get inpatient hospital care, skilled nursing facility care, and hospice care and home health care services after you leave the hospital and you meet certain requirements. Now, Medicare Part B is what we also call medical insurance, and this is an optional health insurance benefit for individuals who qualify for Medicare Part A. Now, everyone pays for Medicare Part B premium. If someone is not paying, it's because, for example, they qualify for assistance because they have limited income and resources, or someone else is paying on their behalf. Medicare Part B covers for doctor services and other providers outside of the hospital, outpatient service, home health care service, durable medical equipment, and many, many preventive services. Lastly, Medicare Part D is the part that pays for prescription drugs. So there is a very limited coverage for prescription drug benefits under Medicare Part A and Part B, specifically outpatient prescription drugs. So if you do need coverage for outpatient prescription drugs, you would need to have a separate prescription drug plan that is sold by private companies to help you pay for when you need medications. So those are kind of like the basic understanding or the basic structure of what Medicare is and the different parts of Medicare: hospital, medical, as well as prescription drugs. So people in Medicare have mainly two choices in terms of how they receive their health care benefits. One is to stay in that original Medicare program that I just explained, and we're going to go a little bit into more detail in a minute. And the other one is to have their health insurance administered by a private health insurance plan, also called Medicare Advantage plan. So those are typically the two choices that people with Medicare have with regards to how they receive their health care benefits. Now, you have the choice, as I mentioned, to stay in the original Medicare. That will entail hospital insurance Part A and medical insurance Part B. If you have other health insurance benefits, such as benefits that you get through an employer plan, TRICARE for military retirees and family members, if you qualify for Medicaid, if you qualify for federal health insurance benefits and so forth, typically when you have original Medicare and you have these other types of health insurance, there is a coordination of benefits that takes place in there, We're not going to go into details about coordination of benefits, but when you have those two types of health coverages, usually Medicare into retirement, Medicare will be your primary health insurance, and then those type of plans will supplement Medicare. Many of those benefits that I mentioned would come with prescription drug benefits, with the exception of Medicaid, which when you qualify for Medicare Part D, you will not qualify for the state to pay for your prescription. So that is to say that when you have other health insurance benefits, you need to contact your health insurance and see how they will coordinate benefits with Medicare. If you do not have any of those other options that I mentioned, then you may look into adding a supplemental plan. It's also called Medigap policy. So Medicare is not an all-inclusive program. So what it means is that you do have out-of-pocket expenses when you go into the hospital and you become an inpatient in the hospital. You have deductibles, co-payments, and co-insurance that could become really expensive, and you would need to have to get some sort of supplemental benefits to help you pay for the costs that are not covered by Medicare. So that is the kind of the options if you stay in that original Medicare. I also mentioned that you have the choice to enroll in a private plan, also called Medicare Advantage plan. Now, to enroll in the Medicare Advantage plans, you first have to be enrolled in both Medicare Part A and B. And what it is this is an all-in-one alternative to original Medicare. So I was mentioning hospital, medical, and how those parts go into the different parts of Medicare. Now, Medicare Advantage plan bundles everything, hospital, medical, and the vast majority of the plans will offer prescription drug benefits. So you would have one card that you would use when you go to the hospital, medical, as well as when you go to the pharmacist. Those plans may have lower out-of-pocket costs than original Medicare, and I think what is compelling about these plans that they have or they offer additional benefits that are not otherwise available under Medicare, which is vision, dental, hearing, and more services that are not typically part of the original Medicare program. So you certainly have the choice to have your health care administered by a private company. Those companies are approved by Medicare, and they have to start by paying for everything that Medicare pays for, and then, as I mentioned, they do offer additional benefits. Now, let's talk a little bit about Part D, because this is what our presentation will be around today with regards to low-income or extra help assistance that people would get under Medicare. So to be eligible for Medicare Part D, the prescription drug benefits, the individual have to be enrolled in Medicare Part A and or Medicare Part B. So either part of Medicare A or B will make you eligible to sign up for a prescription drug plan. Now, as I mentioned, to enroll in a Medicare Advantage plan, you do need both parts of Medicare, Medicare Part A and Medicare Part B. You also have to live in a planned service area. You know, some of the general requirements is that the person cannot be incarcerated. It has to be living in the U.S. Lawfully present here in the U.S., and it cannot live outside of the U.S. to be able to get access to the Part D plan. Now, some of the things that we advise to consider before enrolling in a Part D plan. As I mentioned before, the first question that you need to ask is, do you have other health insurance that may pay for prescription drugs? And if you do have other health insurance that will pay for prescription drugs, the question is this coverage creditable? How do you know whether your coverage is creditable? By law, the insurance company would have to send you a notification every year letting you know whether the plan that you have is credible coverage, meaning that it's as good as better than the Medicare Part D benefit. So you can make an informed decision of whether you would need to enroll in Medicare Part D. and not be penalized. And again, you need to talk to your plan to see how the plan will work with Medicare if you decide to enroll in a Medicare Part D plan. More importantly, if you do have health insurance and other family members are covered under that health insurance, we wanted to make sure that you ask the plan before you make any decision, because enrolling in Medicare Part D may affect the coverage that you have under that plan, and if it affects your coverage, it may affect the coverage of the rest of the family members that are enrolled in that plan as well. Now, in terms of paying for prescription drug benefits, if you have Medicare Part A, B, and D, it would depend, for example, in the medical necessity that you have to get that medication, and mainly the healthcare setting that you get the medication. For example, if you are an inpatient in the hospital, Medicare Part A typically pays for everything that you get in the hospital, including prescription drug benefits. If you get prescription drug benefits outside of the hospital, it would depend, for example, in which drugs you're taking, that the drug may be covered under Medicare Part B or Medicare Part D, depends on which type of medication you're taking. And again, there is a very limited coverage for prescription drugs on the Medicare Part B. For example, Part B covered for immunosuppressant drugs, and drugs that for cancer treatment, therapy, and so forth may be covered under Part B. So again, the coverage of the drug will depend on the setting that you get the drugs and the medical necessity of the drugs. Now, let's talk about the cost of the Medicare Part D benefits. So, of course, those are private plans, and the premiums from plan to plan varies. For next year, the average premium for Medicare Part D plan will be about $30 a month. Those plans typically come with a yearly deductible. So not all the plans have deductibles. If they do have deductible for this year, the maximum deductible is $415. Thereafter, the plan typically paid 75%, and you pay 25% to what we call the initial coverage limits. We're going to go a little bit more in detail about what the initial coverage limits mean, and also catastrophic protection. So that is to say that before we move into what you need help with, we're going to talk about exactly what are the costs under Medicare Part D that you would or potentially can get some assistance. So one is premium, and the other one is the out-of-pocket expenses that you will get under the Medicare Part D. Now, the Medicare Part D premium, as well as the Medicare Part B, as in David, they are based on what we call modified adjusted gross income. And this is not a number on your tax return, but it's a number that is calculated by the IRS. So typically, if you enroll in a Medicare program, Medicare B and D, prescription drug benefits, your information will be shared with the IRS. They're going to be looking at the taxes that you filed from 2 years ago. So for example, if you enroll this year, they're going to be looking at the taxes that you filed in 2018 for 2017 to see if your income falls above certain threshold and whether you may have to pay a little bit more for your Medicare Part B as well as D. So as you can see on the next chart, if your income depends on whether you file your taxes individually or joint tax filer, and if your income falls above those income threshold, you would be paid an additional percentage on your Medicare Part D premium as well as Part D. But in this case, we're just looking at Part D. Now, the percentage is based on a national average standard-based premium that we released every year. For example, for next year, the national average standard premium is $32.74. So what it is, you would be paid a percentage of that premium in addition to the premium that you would have to pay for your Medicare Part D benefits. So typically, again, this is based on individuals' modified adjusted gross income. The information will come from the IRS. If your current information when you enrolled in Medicare, for example, if your premium or your income has gone down, for example, before because you retired, you have other qualifying life events such as married, divorce, you lose an income producing properties, and other things that may qualify you to have a new initial determination. Social Security will send you a notification when we get that information from the IRS, and it will ask you if you have a more recent income that you would like to report that is not necessarily the same as the income that they're using. They will give you instruction how to contact Social Security and have them readjust your premium to your current situation. Now, I mentioned the cost on the Medicare Part D and the structure of the benefits. The slide that you're looking at talked about coverage gap. That coverage gap is about to go away completely next year. That means that through the first phase of the Medicare Part D benefit structure, the individual will pay about 25%, and the rest is subsidized by either the plan and the drug manufacturers. If you buy, for example, brand name drugs, what we used to call a coverage gap after the initial coverage limit, you used to be responsible to pay 100%. Because that gap have been eliminated through the first phase of the program until you reach the catastrophic protection, you will pay about 25%, and the rest is covered by either the plan or discounts through the drug manufacturer if you buy brand name drugs. We have an example here to kind of break this down a little bit to see which cost we are referring to. Now, the true out-of-pocket expenses are is what we call it's what we count until you reach the catastrophic protection of the program. The catastrophic protection this year is about $7,653. So when you, between the plan and yourself and the discount, when you get to $7,653, thereafter, then the plan pays about 95%, and you're usually responsible for only 5%. So the out-of-pocket threshold that you see in here, the $5,100, is again, it's not that the individual itself will be paying the entire $5,100, but that is a combination between the individual and the discount that they get to the drug manufacturer to that initial phase of the program. So what counts toward that maximum out-of-pocket expenses? So as I mentioned, anything that you pay yourself, whether you're drawing money from a medical savings account, health savings account, or flexible spending account, that money will count towards that maximum out-of-pocket protection. Family members that paid on your behalf, qualified state pharmacy assistant programs are programs that are offered at the state level to help you pay for prescription medications. They typically wrapped around the Medicare Part D benefits to help you with your out-of-pocket expenses. Medicare Extra Help, so the LIS or low-income subsidy that you get from Medicare, that expense is going to count towards that maximum out-of-pocket protection. We also have Indian Health Services. If a charity paid on your behalf that is not in connection with an employer plan, that is also counts. And as I mentioned, drug manufacturer discount on the brand name drugs through the coverage gap also count towards that maximum out-of-pocket expenses. The next slide just kind of tell you a little bit about those expenses that don't count towards the maximum out-of-pocket. For example, the amount paid by the plan doesn't count. The monthly drug plan premium, drugs purchased outside of the U.S., drugs that are not covered by the plan, drugs that are excluded from the Medicare Part D benefits, payment made by or reimbursed by your employer plan, government-funded program, other third-party groups, pharmacy assistant programs operating outside of the Medicare Part D, and other types of insurance. Now, I mentioned that there was a slide to kind of break down a little bit because, again, to learn what the extra help is, we need to learn what you need help with. So as you can see, the Medicare Part D program is structured in 3 phases. The first phase is that there is a deductible. There are some plans that don't have a deductible, but typically there may be a deductible, and that could be up to $415. After the deductible, we have what we call the initial coverage phase of the program that is $3,820. So after you meet the deductible, then the plan pays about 75%, and you are responsible for 25%. Once you reach $3,820 between the plan and yourself, plan paying 75, you're paying 25, then you go into the coverage gap that I mentioned. Now, the coverage gap has been breached now. But what it means is that if you take brand name medication through the coverage gap, the drug manufacturer subsidizes 70% of the cost. You pay about 25% of the cost of the drug through the coverage gap up until you reach that catastrophic limit, which is $7,653. So, when you do the calculation, probably the beneficiary is typically responsible to pay about $2,224 out-of-pocket expenses before you reach that catastrophic protection. So that is what the individual would need help with, that out-of-pocket that they would have to pay through the 25% that they're responsible. So what is extra help? So it is a program that helps people with prescription drug costs, also, as I mentioned, called limited income subsidy. And this is for people who have limited income and resources. So for people who have the lowest income and resources will pay no premium deductible, and they either don't have copayment at all, or they have a very small copayment. This is typically an individual who makes less than 135% of the federal poverty level. Now, individuals who have slightly higher income and resources, mainly individuals that goes from 135% to 150%, they still will get assistance with their monthly premium and with out-of-pocket expenses. So that's where the extra help will fall. So individuals who are below 150% of the federal poverty level will get some type of assistance with the out-of-pocket expenses that we just finished going over. That $5,100 out-of-pocket that, again, includes the 25% that you pay for and the discount that you get from the drug manufacturers. Now, how do individuals qualify for extra help? There is a group of individuals that would automatically qualify for extra help. That is an individual who is eligible for full Medicaid coverage. And we also call those individual full benefits dual eligible. Individuals also that qualify for supplemental security income through Social Security, and individuals who qualify for Medicare savings programs. Those are the state programs that help people pay for their Medicare Part B premium, out-of-pocket expenses for those who qualify for the qualified Medicare beneficiary parts, which is individuals who are typically below 100% of the federal poverty level that will get assistance with their Medicare Part B premium. If they have to pay a premium for Part A, they also get assistance with their prescription drug benefits. So again, you were automatically qualified if you already are eligible for one of these programs, Medicaid, SSI, or Medicare savings programs. Everyone else would have to apply. The best way to apply for benefits is through the Social Security online application. And I mentioned that this is the best way because it'll walk you through the application process. And if you're missing some information, you won't be able to keep moving forward with the application. So this is one of the common mistakes that the majority of us make when we fill out application on the paper form, that we just miss information within that form, and then the form will not be complete, and then it'll take time, whether it goes to Social Security or you apply through the state. They will have to contact you to trying to get the additional information so they can proceed with the application. So again, this way, when you go through the online application, the application will walk you step by step so you don't miss any information, and you will get a result sooner if you do it online. So the next slide just basically give you a general idea of the individual's income and resources that may qualify them for assistance. So individuals who are, as I mentioned, below 150% of the federal poverty level. For an individual is about $18,735, and for a couple maybe $25,365, and then there are the resources. Now, those numbers change every year. So in January, we will get a new federal poverty level published by the Department of Health and Human Service, and then those numbers will change. From now until then, we're going to keep using these income and resources up until the new resources, income and resources become available, typically to the end of January or beginning of February. So again, anyone who may fall under these income and resources could potentially qualify for assistance. Even if you have slightly higher income and resources, we advise the individuals to go ahead and apply, because there are income and resources disregard that you may qualify for, and you don't know until you actually submit the application. Now, when we talked about assistance with the premium, we base our assistance with those premiums on what we call regional low-income subsidy benchmark. So every year we release the regional low-income subsidy benchmark, and if you qualify for the full assistance, you will pay no premium at all. If you have income that are slightly above 135% of the federal poverty level, but below 150%, your income or your premium, rather, will be subsidized on a sliding scale. For example, if you are between 135 and 140%, we're going to subsidize 75% of that premium. If you are from 140 to 145, we're going to subsidize 50% of the premium, and then 145 to 150% of the federal poverty level will still subsidize 25% of the premium. So you see how important it is that even if you are above that income threshold, that that you don't qualify, for example, for Medicaid, for SSI or Medicare Savings Program, you could still get substantial assistance with your Medicare Part D premium. Then the other part that you see in the slide is that what we call a de minimis amount. So every year we release what we call the low-income subsidy benchmark plans. Now there are plans operating there already, and sometimes the new premium, the new benchmark may be slightly above that plan premium. If the plan premium is about $2 more than the low-income subsidy benchmark, those plans have the ability to basically waive that additional $2 and keep all those individuals enrolled in that plan without having to switch to another plan next year because the plan will be above the original benchmark. So again, we're gonna reimburse up to the original low-income subsidy benchmark to those plans. And again, the plans that end up about $2 more than that regional benchmark, they have the ability to waive that so the individual can still enroll in the plan with zero premium. Now, how do people get enrolled when they're found eligible for one of those programs? So I mentioned in 2 or 3 slides before that if you get Medicaid, if you get SSI, or you get Medicare Savings Program, typically you will be automatically enrolled in the Medicare Part D plan unless you choose your own plan. So you always have the option to go on the website, on the Medicare Plan Finder, and look for a plan that accommodates your needs and enroll yourself in one of their plans. If you do not take action, we will go ahead and assign you to a plan that will have zero premium and will have small co-payments depends on your income and resources. We also facilitate enrollment, for example, for individuals. As I mentioned, if you get Medicare Savings Program, SSI, or you go ahead and apply through Social Security Administration. So typically the enrollment takes place for those individuals that qualify for Medicaid and SSI. The enrollment typically is going to be retroactive to whatever month you are found qualified for Medicaid and SSI, and of course you qualify for the Part D plan. For everyone else that applied through Social Security, usually the enrollment will take place after the determination is made that that individual qualified for the program. Now, so what is the extra help that the individuals get on their out-of-pocket expenses? So you can see if an individual is institutionalized and they qualify for Medicaid or SSI, they will not have any out-of-pocket expenses. So a zero premium, zero out-of-pocket expenses. And if the individual is receiving home and community-based services, home and community-based services are state programs that helps individuals stay or live independently in the community without having to be living in an institution. So in other words, if it wasn't for the program, the individual would be institutionalized. So if they are enrolled in one of these programs, they pay zero premiums or out-of-pocket expenses. Individuals up to 100% of the federal poverty level only paid about $1.25 for generic and $3.80 for brand name medications. And this happened throughout the phase of the program. So I was mentioning, deductibles, I was mentioning the 25%. So these individuals don't pay, they basically don't pay deductible, they only pay this small copayment, whether they get a generic or a brand name drugs. Full extra help is for those individuals between 100 and 135% of the federal poverty level. You see that they still only pay $3.40 for generic and about $8.50 for brand name medication. And the last one in there is the partial help that I just mentioned. If you apply through Social Security and you are above 135% of the federal poverty level, but below 150%, your copayment is reduced, your deductible is reduced, and your copayment is reduced by about 15% of the cost of the drug. So regardless, individuals do get a significant assistance, depends on where they fall with their income and resources. Now, the Medicare Limited Income Newly Eligible Transition Program was designed to help individuals and making sure that they don't have gap in coverage if they qualify for low-income assistance. So one of the great benefits of applying for low-income assistance is that if you're found eligible, you can enroll right away in the Medicare Part D plan, or we will enroll you if you don't automatically. And the other is that you will not be penalized. So even if you did not enroll in Part D when you should have, if you're found eligible for low-income assistance, you will not have to pay a penalty. That's one of the great benefits. The other benefit is this program that I just have on the screen, the Limited Income Newly Eligible Transition Program. This program was designed, for example, if you are enrolled in Medicare and you apply for Medicaid and you are found eligible for Medicaid retroactively or for SSI retroactively, CMS will put you in a plan prospectively, and then it will put you in a LINet program that will pay for your prescription medications retroactively to the date that you get your eligibility for Medicaid or SSI benefits. For those who apply through Social Security, again, if we get the information, for example, that you get the assistance this month and we get the information next month, typically what we would do, you will be enrolled in the low-income newly eligible transition program for the month that you applied up to when we actually put you in a typical prescription drug plan moving forward. How do you access this program? Typically, as I mentioned, CMS will auto-enroll you. So if we get the information and we see that you are eligible retroactively for Medicaid or SSI, we'll put you on the transition program to pay for retroactively, and then prospectively for the following month, we will put you in a typical, randomly assign you to a Medicare Part D plan. And again, you have the option to choose your own plan. Also, for individuals who go to the pharmacy, if they qualify for Medicaid, SSI, or they qualify for assistance by applying through Social Security or Medicare Savings Program, at the point of sale, if they go to the pharmacy and the pharmacy or the plan doesn't have the information that the individual is actually enrolled in a plan and they qualify for assistance, they will be enrolled in these programs, and then the information will be transferred to CMS, so these individuals could prospectively be auto-enrolled in the Part D plan with the subsidy. Of course, when they go to the pharmacy at the point of sale, they have to show some sort of documentation, whether it's a Medicaid card, whether it's an award letter from Social Security, or if they have a Medicare Savings Program, something that shows that they already qualify for the low-income assistance. They can put them into their plan and then send the information to CMS and then prospectively enroll them in the Part D plan at the pharmacy counter when they get there. They also have the option to submit receipts for previous month of coverage. For example, if they have Medicaid retroactive 2 months ago and they end up paying for the medication themselves, they can actually submit those receipts to the LINet program, and they can verify that the individual was in fact enrolled, and reimburse them for whatever they pay out of pocket. The LINet program has an open formulary, and they don't really have a network pharmacy. So that means that you can go to any network pharmacy, and they will pay for whatever prescription drugs you are taking at that time. So they have an open formulary, and then, of course, you're going to be enrolled in the typical Part D plan moving forward. But up until that point, they're going to pay for that benefits. Pharmacists have fact sheets and information about how to process these claims if the individuals if they found eligible, or they could call CMS or Medicare or the plan to get information about how to access the LINet program. Now, every year we send a reassignment notice, and this is the time of the year that individuals, because the open enrollment is coming up, that is from October 15 through December 7, is when the individuals will have opportunity to compare the plans that they have or enroll if they haven't enrolled during these time frames. And this is the time of the year that we also take to send notifications to the individuals if anything is changing. For example, if the individual is enrolled in a low-income subsidy and the plan is leaving the Medicare program, we're going to be sending those individuals notification indicating that the plan is leaving the Medicare program and they will going to be automatically assigned to another plan with zero premium. Also, individuals who are enrolled in plans that are increasing their premium for the following year, and they will otherwise would have liability to pay the increased premium, we will go ahead and assign those individuals that haven't chosen a plan on their own, meaning that we enroll them automatically. We're going to be assigning them to a new plan for the following year. And again, these notifications will come in a paper which is done color blue, and it will specifically tell you exactly what's changing, whether the plan is leaving or the premium are increasing, and what we are doing. If you are an individual that choose your own plan, and your plan, for example, is increasing for the following year, because you chose your own plan, we're not going to take you out of that plan, but rather we're just going to let you know your plan premium is increasing for next year, and you may be liable to pay the additional premium. And then we usually send a listing of the plans that are below the low-income subsidy benchmark, so the individual could compare those plans and switch plans. Another notification that we send out is if an individual, for example, will not longer automatically qualify for assistance. So every year in July, CMS will do what we call a redetermination or redeeming process to see if that individual will still qualify for assistance for the following year. So if you qualify because you qualify for Medicaid or Medicare savings program, typically the state will let us know whether you're still eligible for that program. So the states do their own redetermination every year to see if you meet the eligibility criteria to still enroll in those programs, Medicaid or Medicare savings programs. If the state sends us a notification that you no longer qualify for the following year, this is where we're going to send you a notification saying, we got a notification from the state or from the Social Security Administration that you no longer qualify for benefits next year. That letter will come on a grade 10 paper, and it will come with an LIS application with a self-stamped envelope that you can just basically fill out that LIS application and send it to Social Security to see if you're still eligible to qualify for assistance for the following year. I just want to briefly mention that if you're found eligible for Medicaid, Medicare Savings Program, or SSI benefits, you're typically eligible for the rest of that year if you are found eligible between January and June, you're typically eligible for assistance through the rest of the year, even if something changes after that. If you are found eligible between July and December of that year for one of these programs, you will be eligible for the rest of the program and the rest of the following year. Even if the situation changes that you no longer qualify, you're going to still retain that assistance for the rest of the year and the following year. And then again, in July, we're going to be redetermining and see if you no longer qualify. And then in September, we typically will send you a notification saying, you no longer qualify, please apply for assistance if you haven't done so. So that is to say that if you receive any sort of notification telling you that you don't qualify for assistance, go ahead and fill out that application. Go ahead to go to the Social Security website and apply to make sure that if you're still qualified, that your subsidy will not be terminated. Now, if you apply for assistance through the Social Security Administration, these are the individuals who are above that 135% typically of the federal poverty level, or individuals who are below 150% of the federal poverty level. Social Security usually will make a determination from 1 year. And then thereafter, they're going to do one initial redetermination, typically take place within 12 months. And they also do, every year, they do what they call cyclical or recurrent determination. They randomly select people and send them an information saying, please fill out this form to make sure that you're still eligible for the LIS. That is to say that if you receive a notification from Social Security, even if nothing has changed, and they're asking you to let them know, please fill out that form and send it, because if you don't, you're going to lose the low-income assistance. So those are the type of redetermination that Social Security do throughout the year. They also, if you have any change in circumstances throughout the year, Social Security will ask you to report those changes, or if Social Security find out that something changed throughout the year, they will send you a notification to verify that if a change will affect you, if it will accept your low-income subsidy, and how you can actually go about filing an appeal or a reconsideration with Social Security. That is to say that you could lose your low-income assistance at any time if something changed throughout the year, that caused your income to go up to the point that you don't qualify for assistance anymore. Now, low-income individuals, individuals who qualify for low-income assistance have what we call an ongoing special enrollment period. It used to be that the individual were able to switch plans every month. That's not the case anymore. While they still qualify for the ongoing special enrollment period, they could only do it once every quarter. So as you can see, from January through March, from April to June, and from July to September, they can switch plan once during that time. So again, they still qualify for the special enrollment period that they can switch plans, but they can only do it once every quarter. The Comprehensive Addiction and Recovery Act established a drug management program to make sure that people who are found to be at risk or potentially at risk or at risk of abusing drugs, typically opioid abusers. And these are individuals that the plan find that they are getting prescriptions from different providers at the same time and getting the same prescriptions at different pharmacies. So if they are identified as potentially at risk, those individuals will not be allowed to take advantage of this special enrollment period that I just mentioned. Those individuals will typically be locked into one doctor that will prescribe and one pharmacy that will dispense those medications. So again, if an individual is found to be potentially at risk or at-risk individual of abusing drugs, they will get a notification from the plan indicating this, allowing them time to respond. And if they are placed in this at-risk category, there's going to be a flag in the system that would not allow these individuals to switch plans during those times that I just mentioned. If they, for example, move out of the plan service area, or they lose low-income subsidy, or they gain low-income subsidy, whatever the case may be, they will have an additional opportunity to switch plans. That concludes the quick overview of the Medicare and the low-income assistance. I think the main message that I would say to take away is that if you think the individual may qualify for assistance, even if they are slightly above or above those income threshold and resources, we do recommend them to apply for assistance. And during this time of the year, please do pay attention to any notification that you would get either from CMS, from the prescription drug plan, or through Social Security, because there may be a potential there for changing plans, or individual who may be losing assistance and they need to file an application right away to see if they still qualify for assistance for the following year. So do not ignore any mail that you would get from Medicare or Social Security or the states. The rest of the few slides that I have in there is just basically additional resources to get more information. And with that, Karen, I'm going to go ahead and pass it over to you to see if we have any questions.
Thank you so much for this great presentation, David. I just wanted to note, because I saw some questions come through, the slides will be made available after the webinar, and we will post them on our website and also send around a notice to anyone who was who participated in the webinar today. So, David, as an initial question, can you give us an idea of how well the Extra Help subsidy is utilized by eligible beneficiaries?
The low-income subsidy has been there since the program started back in 2006, and of course, throughout the years, we have redefined or made it easy for individuals to apply and get access to the low-income assistance. So nowadays, the program is operating very smoothly, and we do, as I say, we streamline the application process, and the communication between Social Security, the states, and CMS have improved throughout the years. So I would say that the program is working almost as intended at this point, and many individuals are taking advantage of the low-income assistance and utilizing all the options to apply it and get eligibility determination quickly from Social Security and the states.
Thank you, David. And for our people on the line who are working with caregiving coalitions, that might be something to keep in mind as you're spreading the word about this program, letting them know that eligible beneficiaries are taking advantage of it and that the process has been streamlined. And sharing that can help encourage caregivers to look into this as a potential resource for their loved ones. Let's see, our next question. So what are some of the most common mistakes that caregivers make in applying for extra help or in benefits in general on behalf of their loved ones?
The most common mistakes that we have identified over the years is missing information on the application. And as I mentioned, that could be mitigated by going to socialsecurity.gov website and applying there at the website, because it walks you through the application, and if you're missing information, it'll not let you go forward without that information. So again, the most common mistake is missing information. Of course, when you apply for assistance directly through the state, typically you would be required to file a paper form through the state. But nevertheless, please do not let that discourage you from applying. If they are missing information, whether it's Social Security or the state, they will let you know which information they're missing, and they will wait until you provide that information to make a determination.
Thank you. And I wanted to just reiterate something that you had said during the presentation. For people whose first choice may not be to go online to fill out an application, and they, for whatever reason, prefer to use the paper, it is good to keep in mind that applying online could potentially highlight that missing information right away, so that you can't proceed with filling it out, and therefore you don't have that waiting period to hear back from your state, for instance, that you're missing information, and that ultimately will delay the process. But again, taking your point that in any event, people should not be dissuaded because there are, it sounds like you're saying, safeguards in case a mistake is made and something is left out of the application. So let's see, our next question. For caregivers who are helping to manage the affairs of loved ones who are already receiving extra help, what types of program notices should they look for, and what dates should they mark on their calendars? And you mentioned some of this in the application, and this actually somewhat resonates with me. I was a family caregiver for my dad, and he lived about 3 hours away from me, and I recall that when I would go visit him, he would have stacks of mail that he'd want me to just to make sure he had taken care of all of his affairs appropriately. So for someone like me, who's a caregiver, maybe a long-distance caregiver, visiting a loved one and helping them go through and manage their papers and manage their affairs, what types of notices, what colors of paper, for instance, should they be looking for, and what particular times of the year should they keep their eyes open?
Sure, and I mentioned that this is the time of the year. So open enrollment is about to begin next month, October 15 through December 7. So you will be receiving notifications from all sorts of places. If you are enrolled in the Medicare Advantage plan or prescription drug plan, whatever the case may be, if you have an employer plan, they're all going to be sending notifications. For example, one of the most important notifications that you would get from the plan is what they call the annual notice of change. Annual notice of change will tell current members or current enrollees of that plan how their plan is changing next year. For example, if their premium is going to go up, they're going to tell you that your premium is going to go up. If they're taking benefits away, they will tell you specifically which benefits they're taking away. And if they're giving you additional benefits, they're also going to be telling you which additional benefits you'll get under that plan. So that is a very important form. Because if your plan is increasing your premium significantly and they're taking away benefits, this is the time that you would go back and you compare what you have with other potential plans that may offer you a better deal in premiums and also benefits. There is another notification that you get from the plan that is called evidence of coverage, and that is separate from the annual notice of change. Evidence of coverage will tell you specifically what type of benefit the plan is going to offer next year, and what does that entail? How do you get access to those benefits? How much you will pay out of pocket for those benefits? And again, this is a very detailed information that will walk you through, for example, if you need a cataract surgery, if you get a knee replacement, if you get eyeglasses, how exactly they're going to pay for these benefits and what would be your out-of-pocket expenses. That's a very important notice also to look for around this time of the year. The plans are already mailing these things out. With regards to low-income assistance, I mentioned that grade letter that you may get. So if you do get a grade letter, that means that you will be losing your low-income subsidy for the following year. And we usually send that notice with an application. So again, I encourage you, specifically those individuals who receive that grade paper, saying that, you're no longer qualified, to go ahead and apply right away. We allow the plans to give you like a grace period of about 3 months. Like, let's say that you no longer qualify after December this year and you got this notification. If you fill up that application and send it to Social Security or apply to the state, the plan can actually keep you enrolled in their plan and not charge you for up to 3 months if they know that you already submitted that application. So again, specifically, there are other notifications that we're sending out, but I will call to your attention, since we are on the topic, to pay attention to that letter, because it's telling you that your assistant is going to wait and go ahead and submit an application right away.
Thank you, David. So just to reinforce what he just said, for those of you who are caring for loved ones on the line or working with caregivers, this year is definitely an important time of year to watch the mail. It's always important to watch the mail, but definitely want to keep your eyes peeled this time of year, especially for grade letters. And just to remind you, the presentation will be made available, so I encourage you to refer back to that slide, which talks about the different types of notices that could be coming to your loved one. That's very helpful information. I think it's very helpful that the notices are actually color-coded to help it make it easier for you to find the documentation as you're through, as caregivers often do. Tons of paperwork. Anything that helps things stand out for us is definitely appreciated. So I have one more question in my queue to ask. So while I'm asking that, I just want to invite everyone to continue to submit questions. This will be your last opportunity as we go through this last question. If you have something you want to ask, feel free to utilize the Ask button to submit that question, and I'll read it. So very generally, David, without having to deliver a new presentation, what other types of help with prescription drug costs can caregivers put on their radar, things in addition to LIS potentially?
Right. Thanks, Karen. So I mentioned when we were looking at those slides about what count towards the out-of-pocket expenses, I mentioned that there are state programs that is called pharmacy system programs that many states offer to individuals who are below certain income, and they may or may not take into account resources. So I would definitely encourage you to check with your states to see if they have pharmacy assistant programs, because again, their income eligibility for those programs may be much more generous than the Medicare LIS. They typically go above the 150% of the federal poverty level, and many of these programs wrapped around the Part D plan. So that means that they will help you with out-of-pocket expenses. There are what we call the charities. There are many charities within the states, depends on where you live, that they also offer assistance with the cost of medication. So I would definitely check to see if there's any charities out there within your state that you may qualify. And again, usually their qualifications are much more generous than qualifying for LIS. There are also drugs companies that offer programs for certain drugs that are typically high cost drugs. There are many drug manufacturers that offer assistance with their drugs. Sometimes the drug is actually free of cost. They may give you a trial of drugs that it may be free of cost, or it may be very small payment at the pharmacy just for administrative cost of the drug. So, so those are three that I can think of that you could check to see if there is assistance available beyond the LIS program.
Thank you. Those are all very helpful resources to know about and potentially pass along to family caregivers. In addition to that information, just want to reiterate that this presentation will be made available after the webinar, and we encourage you to take a look at the additional resources that are included in the PowerPoint. These will also be posted on our website. So with that, we conclude the subject matter Q&A. Thank you again, David and CMS, for an excellent and very informative presentation. We'd also like to thank your colleagues at CMS's National Training Program, Carrie Watson and Kim Lair. We had the pleasure of co-presenting a CMS Learning Series webinar with Carrie and Kim earlier this summer, and we'd like to thank them for their help in making today's presentation possible. And at this point, we'll move to the second part of our webinar and turn our attention to some materials that the National Alliance for Caregiving has developed to help you share basics about Medicare Part D's low-income subsidy directly with caregivers in your community. As most of you are likely already aware, NAC's mission is to advance family caregiving through research, innovation, and advocacy. So you may be wondering how this webinar and toolkit fit into NAC's advocacy work. So just a reminder, or in case you're not already aware, the core principles of NAC's advocacy program are expanding caregiver access to supports and services, protecting the financial security of caregivers, including caregivers as vital members of the health and human service system, and enhancing the health and wellness of caregivers. This slide offers a snapshot of the most common types of support that caregivers often seek as reported in NAC's most recent Caregiving in the U.S. study. And as you can see here, questions about financial help for the care recipient is a recurring theme. You can also see that utilization of these supports and services goes up markedly for all but respite for caregivers who provide care for a year or longer. So the takeaway for purposes of this webinar is that information regarding financial resources isn't limited to those who are new to caregiving. Identifying the resources necessary to maintain a loved one's care is often an ongoing part of the caregiving journey. So the tools we're about to look at are potentially relevant at all stages of the family caregiving experience. And given what we know about the different challenges that family caregivers face, without these resources to help pay for health care costs like prescription drug out-of-pocket expenses, mounting expenses can often threaten not only the financial security of caregivers and their families, but also caregivers' own health and well-being. The financial strain can actually have a ripple effect on caregivers, leading to additional strains which can impact their ability to provide care and even undermine the caregiver's own health and well-being, as I just mentioned. So this is why we are very pleased to present a virtual toolkit to help caregiving coalitions and advocates educate family caregivers about the low-income subsidy that you just heard about. Our toolkit consists of quick reference publications that you can print and disseminate at events such as caregiver conferences and support group meetings. And it will also include in-depth information such as a recording of this webinar, which provide more background on the Extra Help program. So now let's take a closer look at these tools. Beginning with a pocket information card. So this is a tool that's about, I think the measurements are about 3 by 4. It's something that can be easily printed out, a double-sided card that caregivers can stick into their wallets in their pockets and pull out, that gives information on where to go and which documents to gather if you're applying for the low-income subsidy on behalf of your loved one. On the front, it has some eligibility information, some basic information about what the program is, and on the back, it has numbers that you can call for more information about the Medicare Part D low-income subsidy. And again, these are things that can be easily printed out and shared at conferences, caregiving conferences, support group meetings, and things like that. It's designed to be a quick, easy reference tool. Another of these quick reference tools is an extra help fact sheet, and here you'll see an image of that. And it goes over information in a little bit more detail than can fit on the pocket card, but still in a very brief format. It provides information about low-income subsidies coverage, eligibility requirements, the process of applying for LIS, and information about the LIS enrollment period. And here you'll see an overview of the complete contents that will be included in the virtual toolkit. Again, the pocket information card, which I just showed you, the fact sheet. A recording of this webinar will be made available, as will the PowerPoints that accompany the presentations today, and a briefing paper, which incorporates contents from this webinar and other information about the program. We'll also include on this page social media templates that you can use to help get the information out even further. And one way that you can follow this is by visiting the web page that's listed at the bottom, which I'll get to in a moment, where we'll actually post copies of different LIS-related posts and tweets that we make. And you can follow the hashtag #4RX. The page will also include links to additional resources, such as different Social Security Administration pages and web pages and publications, as well as Medicare web pages and publications on the LIS and other programs to help family caregivers help loved ones cover their prescription drug costs. You'll be able to find this virtual toolkit on Medicare's LIS on our website at www.caregiving.org/extrahelp4RX. All of the materials should be made available within the next week after we get time to upload the copy of this webinar onto the website. And we'll also send out a notice to everyone who participated today so that you'll know when the site is live for you to begin downloading and using materials. And once again, we'd like to thank Eli Lilly and Company for their support in helping to make this webinar and this toolkit possible. If you have any questions in the meantime about the launch of this information, please feel free to reach out to us. Our contact information is below. And once again, we thank you for participating today, and we thank you for all that you do to help caregivers. Have a good afternoon.